Welcome to episode 2 of this mini-series on health and inclusion. I'm Ashley Müller with the GCSP, and in this episode, Fleur and Johanna look at diversity and policy.
So within these systems that you mentioned, we need to shift them. What is visible and who is visible within that system? And from a gender perspective, we've developed a policy brief recently on applying a gender lens. And this is really encouraging us to think about the different needs of people, whether they be men, women, boys or girls, or those affected by socioeconomic status, ability, disability, ethnicity, race and age. Some of those differential needs are not always visible, I would suggest. And those people don't always have the access to the rights and benefits of any policy or the ability to participate in developing, implementing and evaluating those policies. Do you think these kind of lenses need to come into play more strongly? We need to gather disaggregated data. We need to see who's missing, what we're not seeing, before we can really design better systems.
I absolutely think so. And it's a fairly sort of abstract concept for what really is basically, are we, in a strange way, do our systems serve the customer well? I mean, we almost take some sort of for-profit language around that and think about who is the end user and how are they being served. What was striking about NCDs in general was that, particularly from middle-income countries, about 20 years ago, countries were starting to say, wait, our main challenge is not so much infectious disease, so much the challenges that that donors are saying. Are the major challenges. We really are having a transition to chronic disease, and health systems had been built up largely around infectious disease, largely around challenges that were very much, of the earlier late in the last century and early in this century, and had not really recognized this transition. So there was a data mismatch at the outset, and a demand sort of muffling at the outset that has helped contribute to our current situation, but also that's pretty typical in the kind of the way a lot of sort of global strategies get implemented at national level without that level of understanding and hearing perhaps the local realities. And so I think it's a model of understanding and listening to, again, that end user. I think there's also a piece of here about what are the lived experience realities that are affecting, that are affecting the affected in a way. What are data there that are not being captured in existing sort of mechanisms and surveillance systems that we have. And that has to do with, I think, what you're speaking about, which could be seen as empowerment or could be seen as sort of, again, better articulation of the needs of the end user. I think we see that a lot in the patient space in global health, where the individual with lived experience is often not consulted, quite frankly, or consulted in a very kind of a little bit as an afterthought. Helen Clark is overseeing the independent advisory board to look at at how the COVID, WHO and the COVID response. And Helen Clark is a brilliant and wonderful person, and we're extraordinarily lucky that she's doing that. But I did, raise that point of, do you have individuals with lived experience of COVID on your committee? Because what we wind up a lot of times is with committees of experts whose expertise is absolutely not to be, is airtight, and yet that expertise of lived experience is often missing in a lot of these commissions. And it's something that I think we need to do.
And it's taking that diversity and inclusion argument a step further, isn't it? Yeah. So that it's not just within our organisations, it's who we consult with as well, who we integrate into our decision-making and policy-making. And I'm also seeing from a practical tool point of view, that design thinking of putting the person who you're trying to meet the needs of at the centre of the policy design and development is critical. Yeah. And we're certainly using empathy mapping and many tools that are publicly available now to really try and help our participants to think in that way.
Yes.
So, Johanna, I think we've certainly established the need to build back better. We need systems that talk to each other. We talk about holistic security at the GCSP, really trying to see security as not just about military or state needs, but about human security needs, applying these different lenses, joining the dots across different thematic areas of expertise. We certainly valued this discussion today, and hearing how health is playing out, both in terms of health outcomes, but also in terms of poverty and inclusion, the inequality that we're seeing that's growing, and what we need to do about it. do you have any takeaways for our listeners? If they were to go away from this podcast and to think about one thing that they could do to try within their sphere of influence, make a change, do you have any thoughts on what some actions might be?
Well, that's a wonderful point. So I think, first of all, I just want to say from the health perspective, individual health security, I would say, is universal health coverage in many ways. It's really having access to the health system. So that and so if you have that, then first of all, just the first thing you can do is be very grateful for that. And the second is to do what you can to try to improve that health system and improve access for others. The other is what's interesting in some ways in this space is that once you boil down to how much of this is also driven by food and by physical activity, the solutions become, in a strange way, incredibly simple. And they're solutions that we can all share if we have access to them. The access is a problem, but the solutions are to eat a healthy diet, to move around, to take a long walk, and to be really grateful for that. It sounds, it's an incredible privilege that we have to eat well, to live in community with one another. Those are really the solutions at the individual level that I hope we all appreciate and will work to make possible for as many people as possible in the world.
Absolutely. Thank you so much, Johanna. It's been an absolute pleasure to speak with you. And I hope that technology and this democratization of information, making it more free and accessible, whether it's a workout video or a food plan, or allowing people to collaborate and bulk order healthy foods and grow their own and learn and figure out how to do things more locally, as you said. I think the solutions are out there. We just need to have the agency and the determination to find them. On this 25th anniversary, Johanna, I know you've been a close friend of the GCSP and now Associate Fellow. You've directed a course, you've written articles, and you've certainly helped to grow our network. Do you have any thoughts on the value of a centre like GCSP as it celebrates its 25th anniversary?
So I have a huge amount of appreciation for Geneva Center for Security Policy, GCSP. And the reason I said the name, sort of spelled it out, was to clarify that when I first came to GCSP, I had no experience in health security, or I didn't realize I did. I was a non-communicable disease person. I'd been really focused in that area for a long time, but I was also confronting the fact that I was needing to step back from my content area and really think more broadly and holistically about global health. I felt like I was sort of saying the same thing, doing the same thing, really, really, really needed to take a bigger view. Coming into sort of looking much more broadly at global health security itself was incredibly valuable. I learned a lot. I hope I provided some useful input from my own background and areas of expertise. But what I thought was most important was something that I think the world needs much more of, and especially in a way the world of a place like Geneva, where there's lots of thought leadership, it was to step out of my comfort zone. I did not know much about the security area. My father was a military historian, so I grew up with a bit of it, but I really did not know much about this area. I certainly was not. There was much that was unfamiliar to me. And in fact, there was quite a bit that was uncomfortable to me. And I say that in a very deliberate way. I think we need to be uncomfortable in order to be able to work across sectors and to work effectively to address the kinds of societal problems that we have, the kinds of existential threats that we're facing. We cannot sit in our own comfort zones, our own areas of expertise, our own familiar silos. And to do so is to be sometimes uncomfortable. And I thought that there was a ethos, a spirit at GCSP of being uncomfortable, of being creative, of saying, okay, you don't know what you're doing, do it anyway. Jump right in. Why don't you go, write a paper on this? Teach a module on that, go engage with these individuals or those individuals. And that very spirit, which is harder as you get older when you have you're established professional, you're supposed to not show that you don't know what you're talking about, was so incredibly valuable. And very much, I think Christian plays a big part in that. I think he's got a great vision. I think there's just an energy and environment at GCSP that contributes to that. It's also taking advantage of the fact that Geneva is a place where lots of different people land and bringing those people into this sphere. So I think those are the things that I'm so tremendously grateful for and that have really, in fact, significantly altered my thinking and the kind of work that I do. And so I just really, really hope and look forward to the next 25 years of GCSP to not grow old and comfortable and middle-aged, but to keep that sense of stay uncomfortable Because by staying uncomfortable, we can solve the kinds of problems that really, really need cooperation and collaboration and discomfort.
Amazing. Thanks so much.
That's all we have now for this mini-series on health and inclusion. Thank you to Ms Fleur Heyworth and Johanna Ralston for this important conversation. In the meantime, don't forget to subscribe to us on Apple iTunes, follow us on Spotify and SoundCloud. Click the next button to get to the next episode and discover more from our 25th anniversary special podcast series.